Hello and welcome to Straumann Live in the Arena of Confidence at IDS. My name is Dr. Artemis Adkins, and on behalf of Straumann Group, I have the pleasure to welcome Dr. Benjamin Sellick to the program to talk about his experience in digital implant dentistry. Welcome to the program.
Thank you. Thank you for having me.
Thank you so much for joining me. If you don't mind to begin, would you please give our audience a little bit of a background about you? You're a prosthodontist. Can you share with us a little bit of your background?
Yes, so I'm a prosthodontist, and obviously I'm from Australia. I've done all my training and practice in Australia. Been around quite a bit, all the various capital cities in Australia. Actually, I've studied in and worked in actually. So really great to be here tonight or today, and go through things with you.
Very good. Thank you so much. So I wanted you to share, since your expertise is in digital dentistry, I wanted you to share with our audiences what are some of the digital tools you use for patient outcomes, and how has this changed your practice?
Yeah, so digital dentistry is a really progressive and interesting area. I love it. It's something that I've grabbed with both hands for probably the last 5-6 years now, and I'm always amazed by the progress every single time we come to one of these events where you see so much development and new products, and it's quite an exciting area. In my own practice, we sort of divide the areas up into three areas. It's a communication tool initially. It's a diagnostic tool, and then at the end of the day, it's really a treatment tool as well.
Very good.
Yeah, so from a communication point of view, really we're trying to get the patient on our level, okay, and we're trying to get a message across to them where basically they can understand exactly what's going on in our dental brains and really get them towards that outcome that we're trying to achieve.
Yes. You mentioned earlier when I was talking to you before, you mentioned that you don't really do any implant surgeries without co-diagnostics now. I'm curious a little bit, if you don't mind, in that context and also overall, how have some of these digital technologies actually changed the way you conduct patient care and changed the way you practice? Yeah,
so co-diagnostics is a great program and something that really has changed the way that I practice in day-to-day practice. There's no substitute for treatment planning, and co-diagnostics really ties all that together. It's a tool where we can integrate the intraoral scan that we might take at a patient level, as well as the radiographic data that we can capture as well. And essentially, by bringing those two things together, we're getting useful and meaningful tools and data that we can then confidently go to the patient and undertake a procedure, a surgery, and know that everything's going to fit well. We can be relaxed, and we can put aside the treatment planning side of things and have confidence in the procedure itself.
Right. And as far as precision,
Yeah, so precision and accuracy, two different things, but we're confident that with the tools that are available to us, we are getting precise outcomes. And one of the beauties of using co-diagnostics is you can pull from different areas, basically tools that really can come from a wide variety and channel them into one central area that can be calibrated and you know it's going to fit.
Yes. Now, let's talk a little bit for our clinician audience out there about what you do with certain types of cases with regards to digital tools. So, for example, let's say we have a simple removable prosthodontic case with a couple of implants. Talk to me a little bit about what you do in the digital, what types of digital tools you use. How do you conduct that?
So I look at all of the different types of cases I see, and I would probably say that 40% of my cases are implant type cases, 40% are crown and bridge or restorative prosthodontics, and probably 20% are removable prosthodontics. So still quite a range.
Yes.
And I feel that the digital aspects of the care can be interacted at all those levels.
Yes.
Okay, it's not sort of only focused at implant dentistry. So from a simple case, and I don't think there's too many simple cases. They're all fairly complex to one degree or another. But from a simple case, we might look at, say, maybe 2 implants or less. We've got a bounded saddle a couple of missing teeth. And what we can do there is we can take an intraoral scan reliably and know that there are landmarks that we can register in the teeth. There's an area of gingival tissue and then obviously the bone support underneath it. And we know that the intraoral scanner can pick that up pretty easily.
Yes.
We can then take the patient in and take a cone beam CT, and with that data from the CT and the data from the scan, that can then be merged and funneled into co-diagnostics. So in that case, you then have all the information you need, and then you can effectively plan your surgery pretty easily, pretty simply. So in that regard, if you do decide you want to have a surgical guide, then the software can help you make that.
Right. You mentioned yesterday, also we had a conversation about if you have, let's say, simple surgical cases with a couple of implants. You also mentioned that you have a workflow for using digital tools. Would you share with us a little bit about that as well?
The more complex cases?
Yes.
Yeah. Okay. So I find the complex cases to be challenging in that we're trying to capture data that's hard to capture.
Yes.
Okay. And if you sort of relate it back to the same principles of removable prosthodontics,
right.
Everything really always comes back to that. You're trying to capture the tissues in a neutral state, and that's super hard to do. Okay, in general.
Yes, it is. They don't stay still.
They don't stay still. They don't stay dry.
Yes, they don't.
They're moving around. You've got lips and muscles and all that sort of thing. So, in a complex case, we can still apply the digital tools. We just need to know how to do it.
Right.
Okay, and what I find is, particularly with the new intraoral scanner, we're able to take a full arch scan quite easily.
Yep.
Without powder. Using simple retraction with basically a rubber retractor, like the Optragate is a really handy tool to have. I've always got about 10,000 of those in my drawer. And then we can take a scan very easily. But that's kind of the hardest part, the scan.
Yes.
The easier part that we can look at is taking the bite record.
Right.
Because in analog or conventional prosthodontics, that's hard. You know, that's hard to get an accurate bite registration. The beauty of digital is it's a snapshot in time. So you've just got to hold that position for a few seconds, boom, you're done.
Yes.
It's like a photo.
Yes.
And that's really where the power of these tools can come into their own. So
very good. Now let's, we've talked a little bit about, of course, implant dentistry, but what about for conventional treatments? I recognize you also use some digital tools for your regular crown and bridge, those types of care. Would you share with our audience some of the information?
Yeah, so the conventional restorative treatments, you have the full range of tools at your disposal. I mean, we have obviously the intraoral scanner, and that can really nicely take that snapshot in time of your preparation. Okay, and the way that I guess the digital technology is going, you're actually able to, in real time, see how your prep has gone. Okay, if you take an initial scan before you start, and then you do your prep, your reduction, you can then check on the screen, check on the tools, and just see how far you've gone. You know, sometimes it can be very challenging to work out how far you've prepped because, you know, you have no readings and you have no indicator. But in terms of, say, a simple onlay or a crown preparation or veneer preps, it's very simple to do that because you're taking that initial scan before you start, a pre-preparation scan, and then after that, do your prep, merges it together, and it can tell you exactly how far you have gone.
Yep.
I've even been able to take a number of scans under rubber dam, and rubber dam, I think, is absolutely crucial for restorative dentistry.
Yes.
And the scanner itself is actually able to recognize the rubber dam and where the tooth is without too much trouble.
Yep.
Very important.
Yes. For clean, good quality dentistry.
Exactly.
Yes, it is. Okay, let's talk a little bit about a more complex case maybe that you have had and how using digital tools sort of helped make that simpler.
Sure.
And create efficiencies and things like that.
Yeah, sure. So some of the more complex cases I'm encountering, whether a patient has had sort of an overclosed dentition,
right.
Difficult occlusions like a a class 3 with no reliable contact points. We see a lot of elderly patients in my practice, just because that's the demographic that we see. So those elderly patients may have been a dentalist for a number of years, and there's very limited tissue to work with. In all of those situations, again, getting back to what we were saying before, it's the bite record that's the hardest part.
Yes.
And how we might capture that in a implant planning sense, if we're looking at implants, is often something we do in combination with a CT scan and a radiographic guide, because I guess to step through the clinical situation, we want to be taking that intraoral scan to register the shape and the size of the tissues, but we also want to see where the bone is in relation to that. And the best way I've found to do that of late is to basically make up a little occlusal rim, an actual analog occlusal rim.
Yep.
And that has some radiographic qualities to it. We pop it in the mouth, we take our CT scan, and then we're actually able to use our intraoral scanner to scan that bite rim, and we then have a negative imprint of that, which we can then marry up with the intraoral scan. And therefore we've got our tissue impression, we've got our bite record, and we have our bone record.
Right.
It all merges together, again into co-diagnostics, and we're able to see everything in 3 dimensions. So that's extremely hard to do in an analog sense.
Right.
But with digital, it becomes a lot simpler.
Yes.
And with tools like co-diagnostics, which we can see up on the screen here, we're able to then digitally, prosthetically set up the teeth and work out exactly how we're heading with the case and how we'd like to head.
I'm curious, just out of curiosity, do you have your own in-house lab?
Yeah, we do.
You do?
Yeah, absolutely. So in-house lab that has the ability to turn around any acrylic type work we need to do, any layering of ceramic type work. But at the present time, we do outsource a lot of our milling and that aspect of our care. But the tools available to the clinician these days means if you want to get into that, you can.
Yes.
You know, you can have some sort of CAD program you can have on your desk. You can export your intraoral scan straight into that, very quickly knock something up in there, whether it's provisional or a bite rim or anything you like. Hit the print button.
And there it is.
And there you go. Very quick and easy.
Yes. Talk to me a little bit about, we had a conversation around original on original parts. And I want to know first from the perspective of philosophy, how you feel about that. And then also, how do you achieve this using digital platforms?
Yeah, so my thesis, my doctoral thesis was basically concerned with the comparison between genuine and non-genuine componentry.
Yes.
And it's a personal subject to me.
Yes.
That I have a lot of interest in, and I guess that was spurned from having seen a lot of cases where people are just restoring implants with the wrong parts.
Right.
As a referral practice, we do see lots of different systems from all over the place. And in Australia, we have patients that come from Southeast Asia, from Africa, from South America, and sometimes in those places, they have clinics there that are geared towards very quick treatments, very quick turnarounds, and often a mixture of different parts. So we do see a lot of those cases where they fail. We see plenty that don't, but in those aspects of non-genuine and genuine parts, we tend to see the high failure rates with non-genuine.
Yeah.
So in my study, we looked at comparing that connection between the parts using micro CT, and we were able to section through these scans and see how the parts joined and meshed together. And we found that obviously there was a great interaction of parts with the genuine,
Right.
which is what you would expect. But we also found that sometimes with the non-genuine parts, they too could fit, in inverted commas, but often they they had a bit of a workaround. They weren't fitting how the original manufacturer intended. It was more a case of, let's just make sure these two bits get together
Right.
and work. So obviously from a prosthetic delivery point of view, that's fine. The patient can leave the office
Right.
and they're happy, they have teeth.
But what happens underneath there?
Exactly. So I think there's certainly more research required in this area, and there's not a lot. Basically, we need to expand on that. But as far as digital tools go, we were able to non-destructively, like we didn't have to cut things in half or anything. We could do it all digitally, and we could see the interaction between the parts. So for me, that was a great benefit.
Yes.
And it actually just added to the conversation for clinicians to think about using the genuine parts rather than often, the generic or less ideal parts.
Yes.
Because I think, patients, they care about the outcome, not necessarily how they get there. And I think we should care how we get there.
Well, and they trust that you are doing, because they have no way to judge this. They have no way to assess whether you're using what parts and which from what manufacturer. So they're judging and you more than the component parts.
Absolutely.
Very good.
Yeah. I mean, I think as clinicians, we may have a tendency to let those decisions be made by our labs. And I think it's on us. Yes. We have to have that conversation to make sure, that we're looking out for our patients and keeping a record of that.
Yes. Now, I'm also, so when I was practicing, I often observed that when I integrated a digital solution into the practice, there was a practice marketing benefit, patient perception benefit. Not that you incorporate digital technologies for that purpose, but there is a secondary sort of benefit to what the patient's perceptions are. Has that been consistent with your experience as well in your practice?
Yeah, it's an interesting point. I mean, I think as clinicians, we focus on, doing the right procedures and getting things done well and basically having good results for our patients. And I think when we start thinking about digital dentistry, we do get a little bit preoccupied and caught up with, is it precise? Is it accurate? Does it look nice? All that sort of thing. Realistically, I think there is this subliminal message that we don't realize we're sending, but patients pick up on the fact that, hey, this clinician, they've got some new fancy tools. They might have Netflix on the roof,
right.
in their practice. They might have Alexa or Siri in the corner doing timers for them. Obviously, we have intraoral scanners and all these things. Patients pick up on that.
Yes.
And it's a subtle thing and a subliminal thing. But really, they're probably more likely to say, "Hey, my dentist has a new toy. They're very modern practice. They know what they're doing with this, and when these tools work, it's a great advertisement for your clinic." I don't think it necessarily always makes you a better dentist.
No,
I think it's a way to just keep at the front line of what's happening in practice and what we're seeing, and yeah, I don't think that should be underestimated.
Yes.
It's a very good practice builder.
Yes.
Absolutely.
Now, another topic I was curious about from your perspective is obviously Straumann is my partner of choice as I'm here. I want to know why Straumann is your partner of choice.
Yeah. Well, Straumann to me has always been, I guess, primarily an educational sort of vantage point for me and a pinnacle. As a prosthodontist, we've spent a lot of time at school, and we've spent a lot of time studying, and at the end of that, you basically realise that there's always more out there to learn.
Yes.
You never stop learning, and my first interaction with Straumann came about from the ITI. And I'm sure everyone's obviously heard of the ITI.
I hope so, and if they haven't, they should check it out.
We should look at it. That's right. But the amount of learning tools on there, be it videos, lectures, photos, even as simple as the SAC tool,
Yes.
Just to assess your cases. That's always been a great reference for me. And when I was first starting out in implant dentistry, I spent a lot of time on there. And just by virtue of that link, you take the next step. And the next step is, well, I want to put some implants in now. Who do I speak to and who do I learn from? So I feel that in dentistry, Straumann is one of the premium brands.
Yes.
And as a restorative specialist, as a prosthodontist who runs a referral practice, I need to put premium products in the patients' mouths and treat them with a premium aspect. So it really, for me, was a bit of a no-brainer jumping from the ITI to a premium product, because at the end of the day, I just want reliability. I think dentistry is hard enough as it is,
Yes.
without having to worry about the componentry and parts that if they're not going to fit or if they're unreliable. So for me, that was a big part of it. There's obviously other choices around, and there's nothing wrong with those other choices. But for me, I wanted trust, and I wanted something that was going to work. On a local level in Australia, we have great technical support. We are a long way from Europe, from the base, but we do have great technical support. And if I am to send something to my lab, and it can get to cares in Europe very quickly, we can turn something around from the milling centre in less than a week sometimes, which is really great. So we know the support's there, and from a sales point of view, it's always easy to pick up the phone or text message my salespeople and say, "Quick, I need something tomorrow," and it's never too hard. So that's really great.
Very good. I want to share something personal with you and then ask for your perspective in it. But often when I was choosing what partner I would, which parts, which products, which partner I would choose for my patient care, of course, the bare minimum, we all go to school for years and years. So the bare minimum is that we want to provide good care in our communities.
Yep.
That I think is basically the assumption. So having put that aside, I also felt a sense of security that a company that I worked with was going to be there. And I give you a personal example where I had a patient came in, actually happened to be an implant case, where the implants placed in there from a few years back, we couldn't identify, and the company, we couldn't identify where it was from, and the company didn't exist anymore. When we did figure out that it wasn't any of the main brands, we didn't have it anymore. And what that patient had to go through to undo a broken situation was so incredibly complex and traumatic. And this patient happened to be 70. Not an easy case to put through a lot of surgical intervention to take it out. I mean, the idea that a brand or a company has the most likelihood to stay around for the duration of your patient's lifespan, for me, was an absolutely important point, especially the lesson after that session, after that experience. Yeah. Talk to me about that. How do you feel about it? Does that resonate with you? Is that accurate for you?
No, that's a huge part of that decision process. And I think mentioning before about seeing a wide variety of implants, we also see a wide variety of implants over time. And in Australia, particularly in, say, 60s, 70s and 80s, probably not 60s, more 70s and 80s, there were a lot of brands that were placed that now no longer exist.
Right.
And as a prosthodontist, we often get those cases and you have to restore them. But further to your point, I actually, probably out of interest, there's actually a clinician in South Australia where I'm from who has taken it upon himself to create a registry of implant parts and fixtures and that sort of thing. And we're seeing that the registration of every single part that goes into patients in Australia, at the moment it's not mandated to record that.
Right.
And what this registry is trying to achieve, and I think it's already in a lot of other countries around the world anyway, but what this registry is trying to achieve is that clarity for the patient, for the 70-year-old who doesn't know what parts they have and what date they'll put in, what reference number, what lot number. All those things are so important, because if we were to go and get, a valve replacement or anything else, a medical thing, that we're treated very differently.
Exactly.
And we shouldn't be. It's
Agreed.
dentistry is in that same conversation, and realistically, we should be treating all of those things as importantly.
I agree.
So, yeah.
Oftentimes by the time someone is needing implant dentistry or surgical intervention, usually they have other comorbidities. My 70-year-old patient that I shared with you, it was not so easy as a case in general, and she had comorbidities that made it even more difficult. So the fact that an implant system was allowed to be in there without us being able to track it or identify it or anything was actually quite a learning for me in terms of human care, what we do with. So I agree with you. Share with me a little bit about the type of practice that you have, because from what I understand, you guys are a multi-specialty practice, and you have 2 practices, if I recall correctly.
I do have 2 practices,
Would you please share with us how you're set up and how the operations work?
Yeah, so between the two, my home base and where I live is in South Australia. It's in Adelaide. It's wine country in Australia.
I'm coming to visit.
Very famous for wine. In the Barossa Valley is just nearby. So that's where we have our lab. It's where we have a large practice. There's 3 prosthodontists, 3 endodontists. We have our lab. We have our oral surgeons who visit as well. And then I have a branch practice which is in Hobart, in Tasmania, which is at the very southern tip of Australia. If you sail a boat out of there, you'll hit South Pole within a few hours. So it's quite a fair way south. And that practice is a little bit different, it's a little bit smaller. But the beauty of having the 2 areas there is we can take a scan in one area and have it emailed to the other area, and co-diagnostics can still talk to each other between the 2 sites. My periodontist in Hobart is able to get a case up for me and send it to me while I'm on the plane, and I can email him back and say, no, move the implant here or there. So these conversations and these treatment planning aspects couldn't happen without these digital tools.
Yes.
And knowing that there's, I guess, a trusted connection between all of them that works, and it's an open system where you can pull in libraries of other fixtures and abutments and all that sort of thing. For me, again, it's a no-brainer.
Yes.
It's very handy.
Yes.
Makes my traveling time a lot easier.
Yes.
Less phone calls in the middle of the night.
Okay, last question, about 30 seconds.
Yep.
Where do you see the future of digital dentistry?
The future? Well, having a stroll around the building today before we came in, it's incredible to see the explosion of technology. There's signs around saying AI, artificial intelligence. There's a real social media drive for things. I think patients are going to be regularly taking selfies and sending them to their dentist automatically. They might even get treatment plans coming back automatically. Now, that scares me a bit. but I think the idea that, we're going to start to, take a thread from here or there and bring it all together, it's very exciting. And we should be, all of us, on that cliff face, ready to jump, and get onto these tools, because I think it can only be better for everyone.
Very much. I agree with you. And on that note, Dr. Sellick, thank you very much for spending some time with me.
Thank you.
And on behalf of Straumann Group, a great big thanks to Dr. Sellick, and I will be back to speak with you guys next with Dr. Chris Kimlievsky and Maya Kimlievska on edentulous treatment using digital technologies. Thank you very much. From IDS Cologne, auf Wiedersehen.